So my name is Daniel Montano. I go by Danny. I've been in law enforcement reaching 23 years now. So when I really started noticing my journey with the mental health, it was when I was with my son's mother, and then about 2006 we started having marital issues, and 2007 we separated and got officially divorced. My son was born Christian. He's currently 18 years old now, and then shortly after that, my ex-wife was pregnant again, and my son Sean passed away the same day that he was born. And just working midnights and dealing with, having to get adjusted to not having my son all the time. And then at one point, my ex just stopped me from seeing my son. So I went to almost 2 years that I didn't get to see him. And in the middle of all that, I was able to fulfill my dream as becoming a police officer. But that's where the struggle really kicked in. Dealing with child support, dealing with not seeing my son, dealing with living at home, feeling that I had nothing to look forward to, financial, so many things piled on. I was on duty. I was working the afternoon shift, and in a park around the corner, I was sitting in my patrol car, and I just started to write thoughts and apologizing. And when I looked down, when I read it back to myself, it was clearly, it sounded like a suicide note, right? I panicked. I got on the radio. I raised my sergeant, and when he arrived, he's like, "Hey, you okay? You sound like you're going through something." And I'm like, "Man, I don't know. I just had these thoughts. I just wrote some stuff down. I don't know what's going on with me." His instinct was to take away my service weapon, and it was like just pounds, like a rucksack, just relief from my back, and I just dropped there on the ground where I was at, and just bawled crying. And the most humbling thing for me was that he sat next to me, and he's like, "What's wrong? What's going on? Talk to me, because we all have problems. We all struggle." And I was immediately taken off the road and referred to the EAP at that time, the EAP program, and sent to counseling. Had to do a psychological exam again, but that was like the beginning of the journey of mental health. Unfortunately, we're in a community or in a world that you have to be the tough guy. You have to be the tough person, if you will, and you have to tough it out, and you gotta suck it up, because this is what it is, right? This is what we signed up to do. But at the end of the day, when we also bleed, and we also hurt, and we also suffer, um, and a lot of us, the majority of us, suffer in silence. So the moment that I decided to step up and seek help was pretty much the first time was my agency forcing me to do these things again because of what happened. I didn't think that I needed help. I just went through an episode where I thought it was normal, and within 2 or 3 months, I flew out to McLean, Florida, which is through Gratitude America, and I did the Warrior Path program in September of 2021. So if you don't know about Community Police Relations Foundation, they have been around for a while, and what they do is they reach out to different communities, and they stand behind the badge, and their leadership is about protecting those who protect the rest of the community. And they've been there for us from day one, and I'm very happy to side with them. I've met a lot of the individuals that run the organization, and I'm glad that they support stuff like here, at least in Dade County. We have a Miami-Dade multi-agency peer support team that we started 2 years ago, and that's thanks to the CPRF, the Dade Chiefs Association, Boulder Crest, that was able to start that program and continue it to this day. We still have the team active. I'm the assistant coordinator for the team, and it's great that we're now taking off with full force and able to have these resources for our fellow brothers and sisters. My why to seek help through these programs was my children. Obviously, I have a 18-year-old. That was the reason why my first breaking point back in 2010, and then knowing that I was going to have a little girl back in 2021 made it my why.
Stories like Danny's are not unique. They're sadly an all too common and overlooked occurrence facing law enforcement. The Community Police Relations Foundation is committed to taking care of those, like Danny, who take care of us, through critical mental health initiatives like Struggle Well and peer-to-peer programming. Your help can ensure that no officer's mental health struggle is met with a blind eye. Your support can be the reason our most vulnerable, best and bravest get a second chance. Stand with us to help them heal. Visit cprfcharity.org to donate and learn more.